Okay, this is my third time starting this again. I don't know why it is not letting me full screen the slides. So hopefully this works for you. If not, you can always go back also into the regular Unit 1 and just view the PowerPoint straight from Canvas, and it will show you to it from the front, but without me speaking. Okay, so this is the one with lecture that we can go through so you can hear it and write notes as you go. In this first slide, it's not slipping to the next one. I'm a little frustrated here. Love technology, hate it. Also, when I did this before, it would not let me play this video. I played the video, but you couldn't hear any sound. So I'll tell you what the video says. You can go back on the PowerPoint in Unit 1 and actually see the video if you want to see the video. So it talks about why is health care so expensive, and it breaks down every dollar of healthcare spent into different sections. It talks about prescription drugs being a huge thing of why 10% of every dollar goes into prescription drugs. I think it's probably more than that now. The drug companies say they have to spend or charge so much money because they're spending so much money in research and development. Big problem there. There's middlemen. There's all kinds of wasted money in the pharmaceutical business. So things need to change. Years ago, insulin would cost not much at all, like $5 to $10 a vial, and now it's in the hundreds of dollars, and it's ridiculous. It's a health saving. I mean, it's a life saving drug. People with diabetes, if they don't get the right amount of insulin, will die, and it's just ridiculous. They have to spend so much money to get it to stay alive. So reform needs to happen there. Also, healthcare is so expensive because doctors have to pay malpractice insurance. So it's insurance to cover if they get sued, if they make a mistake. And big bucks go into when you sue for good reason, but the doctors have to then pass that cost on to the people that they're giving services to cover that insurance in case there is an accident. There's also hospital costs, hospital and clinical care costs. That's actually about 30% of every dollar spent in healthcare. There's administration costs. There's a lot of money too spent in admin of paying the higher ups with hospitals and other such organizations in health care. And then there is the money that is spent for not being healthy, so us choosing to live unhealthy lifestyles, the medicine it takes to offset that. So rather than being home sitting on your couch and watching TV or being so sedentary in one spot, get out and move and get your body healthy, right? Fresh air, eating right, exercise, that can cut down. So because there's so many people who live lifestyles that are not healthy, everybody's having to pay into those, all the care it takes to get better from those or to just even treat problems coming from unhealthy lifestyles. So healthcare is very, very expensive. And that's why, too, also the health industry, because we're seeing more and more people with diseases and problems, that there'll always be jobs in the health industry available. So it's a great industry to get your foot in the door early and grow with it and make changes with it and be part of the changes, be part of the good changes in healthcare. Here is a bill of a hospital care. You won't be able to see it on my big screen. I can see it a lot better in class, but so this just is a breakdown, and it just shows you what they are charging for. I mean, every little thing they charge you for. And if you go in and get Tylenol. When you're in the hospital, you have a stay at the hospital. I mean, they charge you for every little thing, and they charge you a lot for every little thing. Here's a bill. If we look at this up here, this is a 2-day stay in an intensive care unit, and then 4 days stay after that in a semi-private room. Semi-private means you're not even alone. Semi-private means you probably have a curtain that you're drawing and you're sharing your room with somebody, okay? So intensive care was $31,000 for those 2 days. The semi-private room ended up being $20,000 for 4 days. And then you have on the lab, radiology, respiratory services, was probably like oxygen. Let's see, emergency room. So, I mean, it's just crazy. $84,000. This was 6 days in the hospital, $84,000. Next one. Oops, sorry. So this is 9 days in the hospital. And why does it not take this off? Sorry, that's supposed to go on afterwards. 9 days in a semi-private room, also kind of sharing. And then you've got operating room. So this was an inpatient surgery. They used anesthesia. They did end up going into the emergency room and then having an operation and then staying 9 days. Pharmacy, so that's the drugs that was used, medical surgical supplies, radiologist, chest x-rays, $67,000. It's almost $70,000 to stay for 9 days for the surgery. So there's just a huge need to have health insurance. It's just too expensive to not be able to pay for it on your own. I mean, who can pay that on their own? So back into your notes, go ahead and start writing down the words that you see blanks in the notes. And I'm just going to go through this quickly. You can stop it if you need to, you can just go back to the PowerPoint itself, the plain PowerPoint without me speaking, and you can write all the little words in you're missing. So healthcare costs, including dental, are so high that most people have some type of insurance plan. Insurance companies require a fee in return for coverage for specific medical and dental care. So you're paying into this plan so much, usually per month, and then the idea is that you hopefully won't need all that, but you might. And so you pay into this plan, and then if you do need more services, all the other people who paid into this plan who didn't use those services are helping to kind of pay for your services. A premium is a periodic payment for health coverage or prescription drug coverage. A premium is usually paid monthly, and it's usually taken right out of your check, your employment check through your employer. We've got a co-payment, which is the amount that the subscriber or you would pay for medical services. And you pay it to that provider on the day of medical care. So you're going into the doctor to, to have them remove a mole, okay? You're going in to remove a mole. You go in, you pay a certain amount of money that day, and they give you the service, okay? The co-payment and the premium can vary per insurance company, and also within each plan. There's different plans within insurance companies also. And the difference you pay really depends on your deductible. So the deductible is the amount that the subscriber pays before insurance will kick in and pay more. So here's an example. Just example, you have a deductible of $1,000, and that's a pretty low deductible, okay, which means that before insurance is going to start to really pay, you have to hit $1,000. So you go in and say, I hit my $1,000, and then now insurance is going to pay 80% of the next bit of coverage, and I'll pay 20%. Up to a certain point. Then there's an out-of-pocket maximum, and that's the most you'll pay that year for medical services. After that, insurance will kick in and cover the rest. Okay, so if you have a low deductible, you probably have a higher out-of-pocket, okay, because they try to offset it. If you have a low deductible, you're probably going to have higher premiums and higher copays, okay? So the thing is here, if you're seeing the doctor a lot, if you know you have major health issues and you're going to be seeing the doctor a lot, you're going to want to pick a plan that has a low deductible, even though you're paying higher premiums, because you're going to hit that deductible quickly. The big insurance will start kicking in more, and then you'll probably hit your out-of-pocket maximum, and then they'll pay the rest. So if you're not sick, go for a plan that has a really high deductible, say, $5,000 deductible, and you're good unless something major happens, right? So if you never see the doctor, I hardly ever have to go to a doctor. I am never sick enough to get to a doctor, maybe once a year. And so if you choose a higher deductible, my premiums are way lower. So instead of paying like $200 a month, I'm paying $50 a month, okay? And then I only have to worry if something really major happens, okay? Next is health maintenance organizations. So they require members to pay a co-payment for medical services, and you must get medical care from providers that agree to the fee that the HMO is willing to pay. So you've got like there's Select Health and other organizations out there, right? So if you're paying a copay every time you see a doctor, it's more of this health maintenance organization, okay? And you have to see certain doctors. Sometimes your plan might say you could go off plan, but you have to pay more money to whoever you're getting that service from. Then there's preferred provider organizations, and these work closely also. They have contracts to reduce the cost to the companies. And so your employees of these companies contract with these PPOs and agree to see only their providers. Again, you have to choose them, but they've worked out this contract because they know they're going to get so many people in with this huge contract that they can pull that price down lower. And the person you've got insurance through, they cover, they know they're sending so much business that the employer, you don't have to pay a copay. So they'll cover everything for you there. Medicaid is funded by the government. It's for the blind, disabled, and low income. Generally, they'll qualify. So Medicaid is giving aid to those who need it, no matter their age. Okay, it's done for aid for need. Then there's Medicare, which is health insurance provided by the government for people over 65. So your grandparents probably are on Medicare. Medicaid for those in need, Medicare for the elderly. TRICARE is for members of military duty, active duty service retirees and their families. So they are covered under TRICARE. Then we have workman's compensation, and employees that get injured at work or die at work are covered under their state workers' compensation law. This includes getting sick resulting from something that happened at workplace. So my husband, years ago, he worked for a company and he had to use his wrists a lot. And he ended up getting carpal tunnel surgery. And it was all paid for under workman's comp because they could prove that it was on the job that made that happen. And that is paid through your employer actually pays into this, and it has to cover some of those costs. And then, I want you to learn about your insurance. Talk to your parents and fill out the insurance interview worksheet. Or somebody who has insurance, maybe it's Medicare, a grandparent, and I'm not going to look at this information. I don't want the information. I just want you to learn more about preferably your insurance and how it works. What's your deductible? What's your premium and stuff? Once you do that, you don't even send me a picture of it. Let's have your parent or somehow a parent on your email. The parent can say, yes, we filled out this insurance form, and I'll give you the points for it. Okay, because I don't want to snoop. I don't want to know what your insurance is. This is really for you to get information on it. So let's do that somehow through a parent or in your email, have them tell me that you did the interview. Okay, moving on to HIPAA real quick. HIPAA stands for Health Insurance Portability and Accountability Act. It was of 1996, but things didn't really change until 2004 is when there were rules enforced for having problems. And I've got a misspell in here. Let's see if we can fix that right away. What the heck? Okay, so in 2004, it really kicked in. And I remember this time because I had several kids at this point. I had all my 7 kids by this point, seeing doctors regularly for all different reasons. And every time we went in, they had to make sure that you signed the HIPAA forms and you knew that they weren't going to be sharing your information with other people and this and that. And it was a big deal, tons and tons more forms and paperwork. But it was needed because things are switching to online and electronic information, right, and electronic records. And they just want to make sure that your records are kept private. And so in order to update and streamline the insurance reimbursement process, HIPAA was created. There was also concern about easy access to medical records and private information since most of them were in electronic form. And Congress included national standards and mandates for electronic healthcare transactions code identifiers and security. So they all went to using the same codes, a lot of the same pricing for those codes, and very strict security. It set a timeline for implementation. So even though it started in 1996, it said you have this amount of time to build up to it. So really 2004 was really hit big. To protect the use of medical information that can be tracked back to an individual, it allows for patient easier access to their personal medical records while limiting access to records by other institutions. So you can't just share information with other people unless the patient specifically asks for it and in writing, and then it can be shared. So keeping everything private and confidential. They consider confidential information as privileged communication, which should not be given out, but only on a need-to-know basis. This means information should only be shared with those involved in direct care of that individual patient. You might have some really cool cases or things that you hear about or overhear in the hospital or in your clinic, but do not share specific information, especially names. Here at school, too, we have to be very careful when we talk about other students or students' progress and stuff, that we can't do it in front of other students or other parents or anything. No, there's no way that they can tie what we're talking about to the person we're talking about. Same thing. So avoid chatter at the break rooms or in the elevator at work or whatever, especially in the healthcare field, that you don't give out information at all. It's confidential. There are certain things that need to be disclosed to the state health department, okay? These things include births, deaths, cancers, traffic accidents involving use of drugs or alcohol, communicable diseases, so AIDS, hepatitis, sexually transmitted diseases, tuberculosis, West Nile's disease, SARS, and on their COVID, communicable diseases. And anytime you get these sort of incidents, you've got to report to the health department. Awesome. And then last, quickly, we'll just talk a little bit about the ethics right now that's going on, bioethical dilemmas. So some things that should we do them, and why? We need to get smart people who will protect rights along with making the decisions best for people and communities as a whole. One question, should we perform medical tests like blood tests to determine whether or not a person should be eligible for health insurance? Should we perform genetic testing to rule out coverage for certain diseases? So, can insurances say, you need to take this, spit in this tube, we're going to give you a genetic test before we want to give you health insurance coverage? Should we alter a person's genes in eggs and sperm to prevent genetic disorders and diseases in their offspring? This is really interesting to me. I have 7 kids. 4 of them have something called ankylosing spondylitis, and it is a genetic disease that fuses the back end of their spine. I'm almost done. You're good. It causes some major problems. And this is, we totally know it's genetic. Is it proper? Should we, if we know and their children know, should they go in and change those genes so they don't get, they don't get that disease? Things to think about. And then where do we stop? Where's the line, right? If we can do that, why can't we change them and choose our kids' gender, or choose whether our kid's going to be more athletic or more intelligent or have green eyes, right? So where is that line? So you can go ahead and look through here. There's just a few more questions to kind of think about. Where do you fall on the line on these bioethical dilemmas? And start doing research if there's something you want at this age. Be the change. You be the person that stands up for something or makes the change. And let's get some things done. Okay, we're done here. Fill in your notes. Email me if you have any problems. All's great in the world. Love ya. Bye.